Hello, my name is Amanda Winger, and today I chose criminalization of mental health issues for my presentation. What is criminalization of mental health issues? Criminalization of mental health disorder refers to the use of the criminal justice system as a first-line response to people who come to the attention of authorities primarily due to their mental health disorders and then face justice consequences such as arrest, criminal charges, and incarceration. The criminal justice system can be ill-equipped or unable to resolve cases involving serious mental health issues, and the individuals can remain stuck in the loop. Individuals who do go to jail and do not receive mental health assistance can have their original mental health condition deteriorate. A few examples of criminalization of mental health could be a homeless veteran who suffers from PTSD, is found sleeping near a public building and is agitated towards the individuals around him. The local police are called and arrest him for loitering and public disturbance. This individual is then taken into custody, and the PTSD problem is never addressed. Another example is a man with schizophrenia can walk into a store with a weapon. He can say that the voices are telling him to do bad things to people or to kill people in the store. He'll get arrested instead of being taken to the hospital, and he can spend weeks in jail without receiving psychiatric treatment, which is what he really needs. The examples show how behaviors linked to mental illness can be interpreted as a criminal act, and these individuals do not receive the help that they need. The root cause to criminalization can be dated back to the early 1960s. The deinstitutionalization movement eliminated long-term hospitalizations in favor of community support for individuals with mental health disorders. The goal of the deinstitutionalization was to eliminate the incarceration of segregation of people with mental health disorders and to provide help and treatment to this population in their communities. Hundreds of thousands of individuals with mental health illnesses and developmental disabilities were leaving the hospitals to live in the community, which was their right according to the deinstitutionalization movement. The lack of community health centers and level of demand created a barrier for patients to receive proper mental health care outside of their hospitalization. And then most insurance companies also did not cover the mental health interventions that they needed. So without being hospitalized, they never were able to get the help that they actually needed because the facilities were only being built part of the way and never like a finalized project. Another thing that causes the criminalization of mental health issues is called zero tolerance policing. This is a strategy used for reducing crime in places at elevated risk and focuses on cracking down on behaviors that generate fear in the community. This includes enhanced enforcement against violence and prosecution of those who continue to commit violent acts. Yes. So, the impact on healthcare is individuals who do not go to jail or who do go to jail and do not receive mental health assistance. Their original mental health condition can deteriorate and can increase the risk of self-harm and longer recovery when they do finally get their assistance. Stigma around mental health illnesses and inaccurate assumption that people who have mental disorders are very likely to engage in criminal activity continues to fuel the practice of threatening mental disorders as a criminal justice issue. Upon release from jail, many are discharged back to their normal lives before without follow-up care, increasing the risk of being detained again due to their mental health. Emergency departments become default responders for mental health crisis, especially when the police bring in individuals after arrest or de-escalation. Impact to safety. Delayed or denied care can cause individuals who are arrested instead of treated to have an increased risk of self-harm and suicide or medical deterioration. Incarceration separates families and can increase the impact the mental illness has on the individual arrested and the mental health of the families involved. Um, yeah, so this also, when they're released, it can, without proper medical attention to their mental health disorder, they can be released back into like the community, which can also impact the safety if their mental health has deteriorated even worse than it was before. People with mental health disorders who are kept in jail or a prison environment are less likely to get the treatment they need. Patients may only be treated with medications instead of counseling or therapeutic groups or psychiatric help that they might actually need due to the cost. Upon release from jail, many are discharged back to their lives without follow-up care, again, increasing the risk of being detained again. They know this can create barriers to employment too after they are detained because it adds a criminal record to their record. They can also face barriers of reentry into society, which can worsen their battle with mental health. These reentry barriers can include access to jobs, healthcare, and barriers to healthcare will create more difficulty for the individual to get medical assistance and actually receive the help they need for their mental health problem. Financial costs affiliated with criminalization. Financial burdens of incarcerating people with mental health disorders are large. Lengthy and unintended hospitalizations can become an expensive element or even low-level arrests when mental health is a factor. If an individual is arrested and cannot understand their rights or their understanding is diminished due to their mental illness, the case cannot be resolved until the person is stabilized, reevaluated, and declared mentally fit to proceed. These situations are very expensive and move slowly. Financial costs include jail, lawyers, psychological evaluators, and maybe even involve treatment in a state psychiatric hospital, which produces a bill around $250,000 a year per individual. If the individual is sent back to the jail, it is $40,000 a year to care for them. The cost only increases if they need constant care for their mental health disorder. Legal fees. Clients may face thousands in fines, court costs, and attorney fees, even for minor offenses linked to psychiatric symptoms. Loss of income. Incarceration disrupts employment, and a criminal record can prevent future job opportunities, like I said, leading to long-term financial instability. And then the healthcare disruption. It usually can interrupt like continuity of care and access to Medicaid or psychiatric care, forcing individuals with mental health disorders to pay out of pocket for medication or post-release treatment. Also, it can cause housing instability. Criminal records can disqualify individuals from housing programs, which would increase homelessness and the related health costs to that. And also, being homeless and not having a stable environment can lead to like deteriorating mental health problems with the individual. Without treatment, individuals cycle through jails and hospitals, straining law enforcement, healthcare, and social services. One of the companies involved in trying to help with the criminalization of mental health issues is the Crisis Intervention Team, also known as the CIT. This program is to create connections between law enforcement, mental health providers, hospital emergency services, and individuals with mental illness and their families. CIT gives police officers more tools to safely and effectively do their job with more knowledge about mental health disorders. This can reduce the time officers spend responding to a mental health call and also can provide the first responders or law enforcement with effective training to communicate with these individuals who suffer from mental illnesses. By being properly equipped, these first responders can de-escalate and hopefully encourage less detainment of these individuals. By having more knowledge of how to help these people who have mental health issues, they may be able to provide resources or get the individual help without taking them into custody and adding them to the criminal justice system. Mental Health Parity and Addiction Equity Act. This act requires that insurance plans cover mental health care and substance use care at the same level as medical or surgical benefits. So this is really important for our mental health movement in our life right now. Mental health is super important, and this act actually helps people to be able to get the care that they need without paying fully out of pocket, and it's covered just like getting a gallbladder surgery is. So it's very good for our community. Advocating for change. So as a professional nurse, we can advocate for the expansion of mental health diversion programs and mobile crisis units. We can screen for mental health needs, de-escalate situations, and initiate referrals to crisis team or psychiatric services instead of allowing arrest and detention. Most individuals are brought to a hospital to be medically cleared before being booked. The nurse can then conduct a psychiatric assessment and document the need for inpatient stabilization to help with the disconnect of care and to avoid the individual being arrested. And that is my presentation. Thank you so much.